One of the questions patients often ask me is, "Can acupuncture help my knee pain?" My answer is usually, "It depends on why your knee hurts." Some knee conditions may respond very well to acupuncture. Others may need imaging, medical treatment, or even surgery first. So before I think about which acupuncture points to use, I first need to decide whether acupuncture is appropriate at all. To me, that decision is where good treatment begins. A woman in her 50s came to see me with pain on the inside of her right knee. Walking for longer distances made it worse. Stairs were uncomfortable. Kneeling had become something she tried to avoid. She had already reduced many of her normal activities, hoping the pain would eventually settle. When she sat down in my consultation room, she smiled and said, "Maybe this is just what happens when you get older." But I was not ready to accept that explanation. Many patients begin with the same words, "My knee hurts." But the story behind those words is rarely the same. Before treating knee pain, I first consider whether there may be a condition that needs medical investigation or specialist care. A complete ligament rupture may need orthopedic assessment. A severe meniscus tear may require surgery. A large cyst, marked joint swelling, inflammatory arthritis, reactive arthritis, infection, or a rapidly worsening condition may need Western medical treatment first. In these situations, acupuncture may sometimes provide supportive care, but it should not replace the treatment the patient actually needs. Knowing when not to treat is just as important as knowing how to treat. As I examined this patient's knee, several details caught my attention. Her knee moved surprisingly well. There was not swelling. The joint itself felt relatively calm. The ligaments appeared stable, and the movements that often reproduce pain from inside the joint did not fully explain her symptoms. Then I gently pressed one small area along the inside of the knee. She immediately looked at me and said, "That's exactly the pain." It was only a small spot, but it reproduced the discomfort she had experienced for months. That finding made me slow down and look more carefully. At first, I considered the common causes of pain on the inside of the knee, but the examination did not fit the pattern I had expected. I began thinking about structures outside the joint itself. Could a small sensory nerve be contributing to the pain? Could a tendon, muscle, bursa, or even referred pain from another area be involved? From a traditional Chinese medicine perspective, I also considered the meridians traveling through the painful area and whether local stagnation was contributing to her symptoms. For me, modern assessment and traditional Chinese medicine do not compete with each other. One helps me understand the structure and mechanism. The other helps me decide how to approach treatment more broadly. Once I decide that acupuncture is appropriate, I do not automatically needle every painful knee in the same way. The location of the pain helps me decide which meridian may be involved. If the pain is mainly behind the knee, I may consider the bladder meridian and select Kunlun. If the pain is on the outer side, I may consider the gallbladder meridian and use Zulinchi. If the pain is around the front or above the knee, I may consider the stomach meridian and select Nighting. If the pain is mainly on the inside of the knee, I may select points from the yin meridians, such as San Yin Jiao. The painful location is not the whole diagnosis, but it gives me an important direction. I often use distal acupuncture points and then ask the patient to gently move the painful knee. This is sometimes called moving acupuncture. The needles are not necessarily placed directly into the painful area. Instead, I select points along the corresponding meridian and observe what happens while the patient bends and straightens the knee. Does the movement feel easier? Does the pain change? Does the painful area feel different? I like this method because the patient and I can observe the response in real time. Sometimes, a small improvement during movement helps confirm that we are treating in the right direction. Treatment is not always limited to acupuncture. If the knee pain is strongly affected by cold, damp weather, or a pattern of wind-cold damp, I may use moxibustion to warm the area and improve circulation. Lifestyle advice is also important. If excess body weight is placing more pressure on the knee, gradual weight reduction may help. If the patient has osteoarthritis, I may advise reducing repeated high-impact activities or excessive stair climbing during a painful stage. If cold weather aggravates the symptoms, keeping the knee warm may make a meaningful difference. Needles are only one part of treatment. What the patient does between visits also influences recovery. After the first treatment, she told me that walking already felt a little easier. Over the following visits, the sharp pain gradually became less frequent. Climbing stairs became more comfortable. She found herself thinking less about protecting the knee with every movement. Then, one day, she told me, "Yesterday I walked around the supermarket and only realized afterwards that I hadn't been thinking about my knee." That comment stayed with me. Clinicians may focus on pain scores, movement, or physical findings. Patients often measure recovery differently. They remember the moment when they quietly returned to normal life. Looking back, this patient reminded me that acupuncture does not begin with choosing points. It begins much earlier. It begins with asking whether acupuncture is appropriate. It begins with recognizing when a patient may need imaging, medical care, or specialist assessment. And when acupuncture is suitable, treatment should still be based on the patient's individual pain pattern, clinical findings, meridian involvement, general condition, and daily life. Some patients need distal acupuncture and movement. Some may benefit from moxibustion. Some need lifestyle changes. Some need a referral rather than another treatment. Every painful knee deserves its own assessment, because good treatment is not simply about what we are able to do. It is also about knowing what we should do and what we should not do.